Today we're reporting, of course, on the 3 periods since last Friday. Between Friday and Saturday, we had 109 new cases diagnosed with COVID-19. From Saturday to Sunday, there were additional 81 cases, and from Sunday to today, 79. For a total of 269 cases newly identified with COVID-19, and that includes 5 cases which were epidemiologically linked, bringing our total in British Columbia to 5,184 people diagnosed with COVID-19. That includes 1,651 in the Vancouver Coastal Health Region, 2,739 people in the Fraser Health Region, 166 people in the Vancouver Island Health Region, 425 people in Interior Health, and 127 people in the Northern Health Region. In addition, there were 76 people who reside outside of Canada. We now have 913 active cases across the province, of whom 18 are currently in hospital, 5 of whom are in critical care or ICU. Additionally, we have one new death to report over the past 3 days, bringing our total to 202 people who have passed away from COVID-19. And our thoughts and our condolences go out to the families and friends and also to the care providers for the people who have passed away. We have 4,068 people who are now fully recovered, and 2,594 people are on active daily follow-up with public health because they have been a close contact of a case. We have one new healthcare-related outbreak in the Fraser Health Region, and this is at a long-term care home, the MSA Manor. That leaves us with 10 now active outbreaks in our healthcare system, 9 in long-term care or assisted living, and 1 in acute care. And we're up to 713 cases, 430 residents, and 283 staff. We have no new community outbreaks. There are, of course, ongoing community exposure alerts that are being posted on each of the health authority websites and on the BC CDC. And we continue to have flights where people with COVID-19 have been identified, both coming into and flying out of British Columbia. So please do check those websites if you have been in areas where it is a concern. On a positive note, the outbreak at Fraser Valley Packers has now been declared over. As we live with COVID-19 in our communities, our goals continue to be clear. We need to minimize our new cases through our own personal safety measures, those we take ourselves to protect our families, our communities, and those around us. We need to detect new cases as quickly as possible, and that speaks to the work we're doing in public health around the province, as well as ramping up our testing as we've been doing at testing sites around the province. And we need to respond just as quickly to contain the spread of the virus, and that again speaks to the work we do in public health to trace contacts, to make sure that we are connecting with those people who are at risk so they can be managed and so that we can be away from others if we develop symptoms ourselves. Despite the recent outbreaks and clusters that we have seen in the past week and the rising case numbers, we still have low undetected transmission in our province. We are able to find and connect most people who have this disease. But we want to keep it that way. We need to keep it that way as our summer continues and we look to the fall. It's about finding that balance, being able to live with this virus, but ensure that we are doing what we can to keep our society, our medical system, and our economy going. But it also means we all need to do our part to protect those people we know are more vulnerable to having severe illness or dying from COVID-19. And in particular, that's our seniors, our elders, and people in our families and communities who have compromised immune systems. Public health teams continue to closely watch our key indicators, and we are watching them every day to ensure that we are staying where we need to be. And it is a challenging thing to find this balance. We are monitoring the level of community spread, as well as things like the percent positive of the tests that we're doing. As we know, we've ramped up testing to 4,000 to 5,000 tests a day, but our positivity rate remains relatively low, even though the testing is mostly focused on those people who have an exposure risk. So if we started to see that climb, that would worry us as well. Right now, we are staying within the range of where we need to be, although it is always fraught, and we all have to be careful to make sure we're doing our bit to keep us there. Our BC COVID-19 response is about all of us doing our part and taking the right precautions based on our circumstances. It's about protecting those around us and protecting ourselves. It's also how we've done this in BC, by showing kindness and compassion, assuming the best and not the worst. If there's a cluster, if there's a case, public health teams are there, and we will continue to be there to manage. We are identifying close contacts and providing clear direction on what to do. While there are a few that have disregarded public health measures, the new enforcement rules are in place to shore up those gaps that have emerged, and we have maintained and changed and adapted the small number of public health orders that we have to address those situations where we are seeing transmission of this virus. We need to all continue to do the right thing from the get-go so that we don't need to use the enforcement measures that we have for our use now. Showing support for each other, assuming the best, and being an influencer for positive action is how we will get through this storm together. And there are many more months of this to come. All of us need to continue to adjust our approach as we learn more about the virus and tailor our activities to the circumstances we have before us. We need to stay strong, and we need to continue to use our basic steps, our layers, to live safely while COVID-19 is a part of our lives. We have the knowledge, and we have the skills, and we have the expertise to protect our most vulnerable amongst us, our elders, our communities, and ourselves. So let's keep going, doing our best each day, each and every day. And let's also continue to remember to be kind, to be calm, and to be safe.